What's up, everybody? Find out if you have elbow tendinitis, how we diagnose it, why you should care, and a couple things you can do about it to get yourself back on the road to recovery. Coming right up.
I'ma wake up, do bench. Join them subs, it's boredom. Working on nothing anymore, though.
Hi, I'm Burke. I'm a physical therapist, a climber, and I'm the owner of Focus Physical Therapy in Bend, Oregon. Today, we're all about elbows. Here are 10 things that you need to know about tendinitis. Elbow tendinitis is painful inflammation of the common tendon attachment of the forearm muscles on either the outside of the elbow or the inside of the elbow. The outside of the elbow are called the extensors, and this also goes by the name of tennis elbow or lateral epicondylitis. And the inside of the elbow are the flexor muscles, and this is known as golfer's or climber's elbow. Tendons connect muscles to bone and have long strands of collagen fibers with a little bit of elastin in there. The elastin helps absorb forces and regenerate forces, while the collagen is just super strong. Think of it very similar to climbing rope. Just like other structures in our body, these fibers break down with hard use, and they go through a period of new tissue development and maturity to become strong, healthy collagen again. With time and blood flow and the right amount of load, those new fibers do become just as strong, and in fact stronger than they were before. But the key is this takes time. In fact, tendons take more time than muscles. So for beginning and intermediate climbers, your muscles are going to get stronger and adapt to climbing forces much more rapidly than your tendons and other connective tissues will. And so those are the weak links of the chain that have to be accounted for in your training program. It's the recovery time between sessions of climbing and training during which this healing happens. And so those recovery sessions, or what happens in that period of time, is super important. If you stack too many hard days together, you run the risk of starting this process because your body is trying to heal that tissue every time you beat it up. And if you don't give yourself enough recovery in between sessions, you start to build these layers of broken cells that your body is trying to get at in order to heal. It does this by bringing in small blood vessels. Every small blood vessel carries a little nerve. This is what causes swelling. This is what causes pain. Now, elbows in particular, why are they so vulnerable? Two reasons. One, these forearm muscles on this side, the flexors, power up our grip and pinch. These are the long muscles and then the tendons that actually go into our hands and fingers and create that strength. The other is that the muscles on the back side of the forearm stabilize the wrist. They extend the wrist and stabilize it. Without them working, we would not be strong in our grip. When we climb, we use those muscles with high repetition, high frequency, and in very, very specific patterns that in the grand scheme of how we can use our hands and arms is fairly narrow, and this sets us up for repeated micro trauma to the tendon and to the attachment of the tendon to the bone. If you have soreness in any of these spots, on the outside, on the inside, and it goes away by the time of your next session, and you can climb normally without any pain, don't worry about it. That is a micro trauma sign, but your body is doing a good job of recovering. You're repairing those tissues, and over time, that soreness should lessen and you will become stronger. If, however, that soreness doesn't go away, and you can feel it when you start to climb, and you can feel it at other times, in particular at night when you're resting, that's a sign that you could be developing a tendinitis. Now, a common misconception about tendinitis. Tendinitis is really the first few days of this injury. That's when there is inflammation, there is swelling, there is pain. After a few days, the inflammation subsides, but the process continues, and that process is your body trying to remodel those damaged structures, and it does not do that through inflammation. So all of the treatments for inflammation, things like medicines, a hot cold, rest, those are really only good for the first few days. After that, we need to pivot our plan to treat something called a tendinosis, which is a sign of improperly healing tissues that need different types of load, different types of stimulation in order to become strong, healthy, mature, and pain-free. So tendinitis, first few days. Beyond that point, we're looking at a process that's very different. I'm going to show you these tests right now to determine if you have elbow tendinitis. And at the end of this video, I'm going to give you a few key activities that you can do for tendinosis that will help you start to turn it around. So I hope you'll watch through to the end. Here we go. Okay, here are a few keys to treatment. Number one, mobilize frequently. Every few hours, move through flexibility for your extensors, flexibility for your flexors, and make sure that your tissues are gliding properly. Number two, exercise. Exercise is critical. Exercise signals those fibers in how they need to develop and form. So it's mandatory to include exercise in your recovery program. So the Flexbar is a very common tool for treating elbow tendinitis or tendinosis. And in our case, we are going to progress from a concentric shortening exercise to an eccentric to an isometric, which is what we do when we climb. So here's how we use the Flexbar for that. If I have pain here, if I have pain here, for this, after about 3 weeks or so of exercise, if you're starting to feel better, you can begin to try some double arm DeadHangs. No extra weight, no really small grips, pretty good solid grips. Begin 10 to 20 seconds, 3 to 5 repetitions with big jugs, and then progress over the next 2 to 3 weeks down to smaller surfaces. Make sure you have a minimum of 2 days, complete days of rest in between each of those sessions. So we're looking at once every 3 days, possibly even 4 if this has been a really long process for you. Well, I hope this has been helpful for you. Leave a comment in the comment section below if you have questions. Tell me what you think. Did you like it? Was it helpful? Was it not helpful? Is there anything that I can do to make these videos more useful to you? Thanks for watching. I hope you'll smash that subscribe button and come back and see us again for the next video related to physio and climbing. Thanks so much.